Most of my lifestyle, it was always based on doing physical things. I always hunted and fished and that type of thing, and I mean, you can't do it anymore. You sometimes lose your balance just out of nowhere. It's aggravating as hell.
I just think it's magical that you can learn so much from just watching an older person walk. It tells us more than just about how the person gets from point A to point B.
I fell and broke the femur.
Your balance was getting pretty bad, was it?
Yeah.
You must have been pretty darn tired by the look of this.
I was, yeah.
If there was a blood test that was as useful as knowing mobility and balance now compared with 2 weeks ago, you could patent it, you make $1 billion.
Now I want to see how you actually get up with your cane and go to your chair.
When an older adult gets sick, often the first sign of disease is problems with mobility and balance. And it's not because there's a problem in the knees or the ankles or the hips, it's because their overall health is poor.
Now do you get dizzy when you stand up like that?
Not dizzy, but I'm
A little lightheaded.
a little light.
When you do get up, take your time.
That's right. I'm aware of it, and I don't want to fall again.
It's hard to get doctors and nurses and other healthcare providers to change their practice, to change their ideas. They have hard-fought knowledge. Having people routinely ask, what's their mobility and balance like now, and what was it like 2 weeks ago? It may seem like a small thing, but it's been a huge investment of time, and I think it's paying dividends in terms of our providing more rational care for elderly people who are frail and who are acutely ill.
I'm trying to measure mobility where it's most difficult to measure, and that's when individuals are so unwell that they're not able to get out of bed. I'm developing, in conjunction with a computer science program, a bed that actually measures how well or how poorly an individual is able to move. From day to day, that can tell you if they're getting better or if they're getting worse.
You're never going to make a pair of 80-year-old legs into a pair of 16-year-old legs. I mean, that's out of the question. It gets him maybe back down to a 78 again.
Even if we're really successful, we won't put them back to the young person, we'll put them back to a frail person who's less vulnerable.
Get those movements, that nice crawl.
Here at the Geriatric Day Hospital, a lot of the work focuses on mobility in the ways of just taking every limb through its full range of motion. All of those things are designed to work together to make them start moving.
Careful there, Bill, you're hitting the other Bill.
It does do something for your self-confidence when you feel you're stronger.
And up, and straighten.
I can do things, exercises now that I couldn't do when I first came down here. It's the old saying, if you don't use it, you're going to lose it.